Right, there's so much uncertainty right now, plenty of misinformation out there, so we're taking your questions straight to our experts, doing this every night. You can tweet us your questions to @FoxNewsNight. Providing your answers tonight, board-certified medical doctor Janette Nesheiwat, also part of the Fox family now, and Chief Medical Officer at HEAL, Dr. Renee Dua. Thank you both for giving us time tonight. We appreciate it.
Thank you.
Thank you, Shannon. All right, we have viewer questions, but I have a couple of other things that I keep commonly getting asked, so I want to ask you guys about this. Dr. Nesheiwat, first of all, I keep hearing people worried about ibuprofen if they think they have flu, if they suspect they have COVID. There are worries and rumors all over Twitter that if you take ibuprofen, it could actually be a negative thing. Do you know anything about that? What can you tell us?
Yes, so there's actually no specific data or studies to prove that this is true, but the thought is that if you take ibuprofen, it can actually allow for the virus to enter the cell more easily, therefore it can make you more sick. But this hasn't been proven. I think if you take 1 dose or 2 doses, it's not going to really make a huge difference. But there is an alternative, which is acetaminophen, also known as Tylenol, that can help reduce fever. In addition to drinking lots of fluids, staying hydrated is very important to help reduce the fever and try to get you feeling better.
Okay, and so Dr. Dua, we have heard if you do have worries that this is that you have an illness, you maybe need to get tested. We're told don't show up at the ER, call your doctor's office. But what about the possibility of house calls? It seems like an old school way of doing things, but are there doctors who will actually come see you? Is telemedicine an option? What's the best way to go?
Sure. So we started a company called HEAL, the company of which I'm a chief medical officer, and that's the entire idea. If you do have mild symptoms, the best thing to do is stay at home, and presumably, if you're not feeling horribly, you don't need to be tested. On the other hand, if you're feeling terribly, you think you need to be tested, right now the best thing to do is to work with the Department of Health to figure out where to go to get testing. We do deliver house calls, but what's been really interesting about our house call delivery system is, first, we have released telemedicine so that we can deliver access to patients. But second, there are plenty of people who have no symptoms, but they are diabetic, they are hypertensive, they have anxiety or depression, which is especially concerning at these crazy times. And so these house calls are actually helping them get the access to care that they need for their chronic disease. So that's been a really important piece of what we're adding in our care model.
It's such a personal thing and something that I think would go a long way for people, like you said, who have anxiety or are trapped at home or they feel like they shouldn't go out. It's a good option to have. Okay, so let's get to some viewer questions here. Nate Coggin says, should we be concerned about virus spreading on newspapers, including those delivered to homes and businesses? For some reason, he says including the Wall Street Journal. I don't know why that one would be more germy than any others. But the fact is, I think about this now, bringing in the mail or bringing in packages. Dr. Nesheiwat, what do you say?
Yes, so it is possible for viruses, bacteria, fungus to live on inanimate objects. So if you see obvious debris, then yes, you want to clean it off. But really what's most important is after handling a package or something that's delivered to you or a newspaper, wash your hands. That's the #1 way to prevent the spread of infection. And the best thing you can do to protect yourself is just hand washing.
Yeah, so in overabundance of that, we've now had to buy a bunch of hand lotion too, because we're all washing much more, which is a good thing. But now everybody's got dried out, scaly skin. Okay, if that's our worst problem, we're doing great. Okay, Clever Patriot tweets this in. If I need medical refills but don't want to go to my physician, what do I do? Dr. Dua, what would you recommend?
So this is a perfect reason to use our app, right? Book a visit, use heal.com, and have either a house call doctor come or get a telemedicine visit for refills.
Okay, simple. You don't have to leave your home. You can check it out other ways or call your doctor's office.
In fact, we want you to stay home.
Yeah, I think for right now, that's the best advice for just about everybody who feels sick or has a problem. Okay, Linda GDG tweets, hi Shannon, if a spouse tests positive for COVID-19 and self-quarantines, should the other spouse remain home with them? My husband and I are the only ones in the house and we're fine and healthy at this time. Thanks. Dr. Nesheiwat, if you have a positive test in the house, what should everybody else do?
Yes, that's a great question. And because Linda, you were exposed to your husband, you should also be in quarantine as well. And be careful. You still want to, not infect other people that are in the house. That's a very common problem. So there could be, kids in one room, parents in the other room, and you can infect one another. So it's important to everyone be quarantined so we don't spread from one person to another and outside the family as well.
So if someone is staying home, they're ill, but you're helping tend to them, you know, is it just a given that you may get infected? Should both of you be wearing masks? I mean, what's the best idea there?
It's tough. It's really tough, especially if you live in small quarters. But if what you want to do is, if the person that's sick, that's definitely been diagnosed, yes, they're the ones that should be wearing a mask. And then the person that's taking care of them also has to wear what's called PPEs, personal protective equipment, masks, gowns, gloves, and change it often as well, so that you're not, accidentally contaminating yourself.
Okay. Now, Beth Clardy tweets in, are there any home remedies that will help deter the virus? I've been reading that heat will kill the virus, such as deep breathing and hot steam rooms. Your thoughts on this, please, and thanks. Dr. Dua?
I think, when infection is spreading, you want to stay in a cool, clean, dry climate, right? Lots of hand washing, available hand sanitizer, lots of, we're recommending 6 feet apart from each other. Those are the important steps to take to stop the spread of infection and really quell its transmission.
Yeah, I've heard some of this too about whether if you're having chest issues or you're suffering from, any kind of respiratory thing, that if you can steam it out in a hot shower, that may be a good place to open things up. Is that the case with the COVID or no?
I don't think we're sure yet, right? I think we're learning so much about this virus every single day, and they do that a lot. For children, for example, a humidifier will be set up, and certainly there's probably some symptomatic relief. But I think you have to also be careful with humidifiers. They need to be cleaned properly, right? So for that reason, I'm suggesting the face mask and the hand washing and the separation.
Okay. Next up from Kelly says, what fever reducer should we use for coronavirus? Ibuprofen's a no, alternate Tylenol, and what? So, Dr. Nesheiwat, you had mentioned acetaminophen. Are there other things? Is it just for now avoid the ibuprofen? What are the other options?
Well, I don't think if you take 1 or 2 doses of ibuprofen, that's really going to make it worse. Again, there's no data or studies that show that that's actually true. But yes, Tylenol, acetaminophen, and fluids can definitely help reduce your temperature. And of course, rest. And again, the biggest issue is we don't want your illness to be spread to other people. So staying home is a big one, and just resting so that you're not overexerting your body and not picking up other infections, because we do worry about secondary bacterial infections as well.
Yeah, when your body's already run down.
Yeah.
Okay, Hayden Hudson asked this. I've heard rumors that COVID-19 can cause kidney problems and potential male reproductive problems. Any truth to this? Dr. Dua?
So with the male reproduction, there was some question about it, and it's not been proven. With the kidney issues, anytime a patient gets severely ill and they can't breathe well, their blood pressure might drop, and then of course their kidneys will suffer. So this is a patient who might even be in the ICU, who needs aggressive rehydration. And theoretically, the vast majority of cases of patients who have COVID are not this sick.
Okay, and very quickly, for either one of you that would want to field this, I've seen a lot of chatter out there and stuff on the web too about if we run low on these ventilators, there's some way that CPAP machines that people with sleep apnea and other issues use overnight could possibly be used in a way that would in some way provide some kind of ventilator type benefit.
Well, possibly, but we actually would turn to old-fashioned bamboo bags that we would use out in the, out on the streets, out, in the homes. But hopefully we don't get to that point where we're using last resort items, and we're preparing now and trying to prevent the spread of this virus so that we're not going to have a surge of patients requiring ventilator breathing assistance.
All right. Dr. Nesheiwat, Dr. Dua, thank you so much for both of your time, and we're just sending our prayers with you as you're out there on the front lines. Thank you so much.